Hi, this is Jenny from Beach's Pelvic Physio again. I'm here to talk about endometriosis this week. March is Endometriosis Awareness Month, so we've been posting a few things about it. This session is more what pelvic health physios, what our role is within endometriosis. So just before we get into that, I'll just do a bit of background that endometriosis is a really common disease, often really poorly managed. Approximately 10% of the female population, or those assigned female at birth, will have endometriosis, but not everyone realises they have it. A lot of people are dismissed with their symptoms when they go to GPs and specialists and told it's just period pain, put up with it. Or they come from a background where their mum may have had endometriosis and all those symptoms and thinks that that's normal, so they're not advised to get help. So typical symptoms of endometriosis are period pain that's not relieved by simple analgesics like Panadol and Nurofen, period pain or symptoms that cause time off work, school, normal sporting activities, other activities. Other symptoms that are related to the menstrual cycle, so occur at typical times per month. Those typical things are fatigue, bowel pain, bladder pain, nausea, vomiting, diarrhea or constipation, dizziness, bladder or bowel urgency, frequency, heavy periods, irregular periods, pain at ovulation, or pain with penetrative intercourse. All very common symptoms. You may have all of them, you may have very few of them. You may have very few symptoms at all and have endometriosis, but that's more picked up with fertility issues later on down the line. So if you do have any of those symptoms and you're concerned, or know someone that has those symptoms and who hasn't had any treatment, go have a discussion with your GP. If you are dismissed by your GP, which unfortunately sometimes you will be, get a second opinion. If you're unsure who to turn to for that second opinion, get in touch, because we have a network of local GPs and specialists who are very proactive with endometriosis symptoms and will help you. So before we go further, just to explain quickly what endometriosis is for those of you who don't know. Endometrium, I'll spit it out, is the lining of the uterus that thickens up during a menstrual cycle and then breaks away at the end of the month to create the bleed of the period. So the endometriosis occurs when those endometrial cells, the cells that make up that lining of the uterus, get laid down outside the uterus. Most commonly around the ovaries, the bladder, the bowel, intestines, but they can also get laid down in the chest cavities, around the lungs, or in the brain. Because they respond to the hormones that create the hormonal cycle, the menstrual cycle, they will continue to thicken up and break down with that monthly cycle. So effectively you get a bleed each month in areas where it can't escape. So that tends to cause a lot of pain. And the other symptoms that we talked about above, which can ultimately lead to a stickiness between the layers of tissues between the organs and adhesions, sometimes where the organs stick to each other, again causing increased pain again. So with regards to pain, our usual response is protective. Our muscles tighten, we feel tense, our stress levels go up, and we tend to back off our usual activity. If that's a one-off episode of pain, no big deal. The pain subsides, we return to normal activity, and everything's fine. But if the pain is recurrent, and with endo, that's every month for years at a time, a pattern becomes more ingrained, and the body literally physically learns that, laying down new neural pathways to link those physical reactions with the feelings and emotions, to the altered sensations. Given that pain is generally a negative experience, these repeated episodes usually create a negative cycle where things get worse and worse and worse over time. You're often left with some residual muscle tightness or pain after an acute pain episode, or the body starts to dread, like your brain subconsciously dreads the next episode, and will tighten up in preparation for the pain coming. It's very closely linked to fear, anxiety, and those negative emotions as well. So that's normal chronic pain behaviour, and this is where we as physios, or pelvic health physios, come in. We can't change the pathology of endometriosis, but we can unwind those secondary effects of the chronic pain. So we release soft tissues, we regain normal joint mobility, we reteach normal breathing mechanics, we utilise relaxation, mindfulness, yoga techniques to calm the neural system down as a whole. We build self-release, stretching, breathwork programs to help you manage the symptoms yourself. We restore normal deep core function and global mechanics and strength to effectively offload the pelvic floor. If they're weak, pelvic floor will often get more tight. We help you identify other lifestyle factors that could be amplifying your pain, such as your sleep patterns, nutrition, gut health, strength, other life stresses. We also utilise things like the TENS units for pain relief in the moment. So there's lots we can do to help you decrease those secondary effects of pain. And our aim is to help you learn to identify what is the pathological endometriosis pain and what is secondary contributing factors that you can actually control. And we can see a massive improvement in symptoms by looking after those secondary effects. So we can do that at any point in your endometriosis journey. We can do that early on before you've even been diagnosed, if you're having lots of pain symptoms. Or we can do it later on, like after you've been formally diagnosed, you've maybe had surgery and the pain hasn't decreased completely. It's really up to you when you seek help. Like I say, we can help you find GPs and specialists who have a special focus on endometriosis and are very good with managing these things. We always work closely with our network of GPs and specialists, plus our nutritionists, psychologists, acupuncturists, all who have a role to play within endometriosis. So if you'd like more information, please call us on 0435 150 136 or on 02 8964 5579, or you can email us at hello@beachespelvic.physio. Or you can follow us on, or follow us on our socials, Facebook, Instagram, YouTube, or beachespelvic.physio. Like I said last time, we're going to keep putting out more information over the next few weeks. So sign up and we'll keep you in touch. All right, we'll look forward to seeing you soon. Thanks, bye.